It's wonderful to be here. As you say, I tend to come on every now and then, often when there is a new book. And what I'd love to do is really to consider what are the implications for my latest book around rethinking the state in a mission-oriented way for how we think about a bold approach to healthcare and health innovation. Really kind of a people-centered approach, but also bringing this notion of stakeholder value, which companies around the world are talking about, to turn it into a walk. And let's use the health area as a sandbox. And if we can't get it right now, then we should stop using that word stakeholder value and just use the status quo. But I don't think we can afford that. So let's continue to be ambitious. Now, the COVID moment is quite an extremely challenging one in terms also of what we've learned about our unpreparedness. Whether it's delivering personal protection equipment to frontline workers, whether it's actually rolling out properly a test and trace system globally, at the city, regional, national, international level, whether it's actually governing vaccine production in such a way that it's actually accessible universally, right? Because the vaccine itself is not the mission. The mission is getting it out there and making sure everyone gets vaccinated. But also the digital divide. I've got 4 kids. They've been working at home for a year now. And of course, we're all very aware that the ability of students to access their human right really to education during this period has been incredibly different depending on people's social and economic background. And of course, this crisis, the COVID crisis, is on the back of multiple crises. We just a little over 10 years ago had the financial crisis, which many countries, again, are still trying to get their feet back, on the right mode in terms of actually having a definancialized economic system, but also the climate crisis. It's very much out there. And unfortunately, we are not moving as fast as, Greta Thunberg told us we should be moving. She said, if your house is on fire, you don't just sit there and philosophize what to do, you get out. And if you look at all the data, including from 2 years ago in the EU, where we spent over 55 billion in subsidies to fossil fuel projects, but also, unfortunately, the coronavirus relief funds are still going towards fossil fuel, areas. We are simply not moving at pace. And so one of the things I've been reflecting quite a bit on, also in some of your previous events, is, why can't we, act more proactively? Why can't we confront our economy in a proactive way without government in particular always thinking that at best its role is there to patch things up, to actually wait for a crisis before it comes in, or even to justify any sort of policy even before the crisis hits? It's seen as fixing a market failure. And if policy and if the public sector is there at best to fix market failures, we will by definition always be too little too late. So, the different failures are things like negative externalities, which create pollution, and the bandage that we need would be something like a carbon tax, or not enough funding of areas that are considered public goods due to the positive externalities like basic research and R&D. Then, of course, you need the government to do that. But all these different things, including SME financing for different types of information failures, it's not that those failures don't exist. It's that we can't transition towards a better economy and build back better if we are always just patching things up, literally that big bandage there, right? So what I've been trying to do is to help policymakers be more bold, be more ambitious, and remember that what we did 50 years ago, which was to get, people, humans to the moon, but also at pace, because you'll remember that the goal was getting to the moon and back again in 1 generation. That's what Kennedy, talked about in his famous 1962 speech. That required a lot of ambition within policy, but a really dynamic public-private partnership. There were so many different sectors that got involved. It wasn't just aeronautics, it was nutrition, electronics, materials. The whole software industry in some ways was an outcome of that very bold mission. And, if you remember Kennedy's speech, he was very clear that it was going to be hard. Thinking of it today, we need to, fight climate change because it's hard, not because it's easy. That's what he said about the moon landing. But also that real willingness to experiment. They had no clue how to get to the moon during Kennedy's speech. They kind of fudged it. There was lots of different possibilities, and they ended up focusing on the lunar orbit rendezvous way, but that willingness to experiment, right? The idea that you're purpose-driven and you're going to need to throw at this problem lots of innovation by lots of different actors, public and private, and that you will probably fail along the way. They were very clear about that, by the way. And what was interesting was that NASA itself, when it, because it was so purpose-driven, they had a really ambitious goal. They had to look inside their own organization. And in fact, after that terrible Apollo 1 fire, when one of the astronauts, Gus Grissom, said, just before dying, he said, how the hell are we going to get to the moon if we can't even talk between 2 or 3 NASA buildings within a square, kilometer of each other? They looked inside their own organization and tried to really facilitate that communication, to work outside of the usual silos that we know that many, government departments, for example, often are afflicted by. And that idea that if you're purpose driven, you have to change your own organizational culture and how you work with different actors in the economy is just so important, because otherwise we just say, oh, government is just so bureaucratic. Well, no, we have the wrong kind of bureaucracies. We need creative, dynamic, agile, flexible bureaucracies. And also what was quite incredible was all the spillovers that happened along the way. Even though the goal was getting to the moon, along the way, a lot of the things that are in our iPhones, came from that, but also all these very concrete things like baby diapers and home insulation and so on. But even more interesting, and this is something I've been reflecting a lot on, is how they partnered, how NASA partnered with business was in fact very kind of stakeholder value driven, using the words of today. They had clauses like no excess profits, right? We're doing this together and we're going to share in the rewards. We can't kind of use this as a gambling casino. And they really took care to redesign their procurement contracts so that they were fixed price instead of cost plus, where costs could just get inflated very easily, a fixed price, but with incentives for continual innovation and quality improvement. And again, just so interesting that they cared about designing the contract, the relationship, the social contract between public and private in such a way that really was both goal-oriented, incentivizing constant innovation, but also fair in terms of how the profits were distributed. And they also were very aware that they needed capabilities in-house. There was this wonderful quote by the head of procurement, Ernest Brackett, who said, if we're not smart ourselves, if we're not investing within our own, knowledge creating mechanism, we're going to get captured by the brochuremanship. This would be of today's consulting companies with their fancy PowerPoints. At the time, they had nice brochures. And so really, what's so important is to ask ourselves, what are the lessons, from the moon landing, which was just over 50 years ago, for these really important goals that we have today, whether it be around the digital divide, whether it be around, all these 17 amazing goals that every country has signed up to, the SDGs, of which some are health related, some are focus much more on inequalities. Many have to do with sustainability, climate change, and so on. What does it mean to turn these bold challenges that we've all signed up to? In 2015, every country signed up to the 17 SDGs and turning them into moonshots that really get that intersectoral and interactor investment in innovation, but designing the contracts to make that happen. And of course, these goals, the SDGs, and also those around health and climate and so on, are harder than going to the moon, right? Because they embed within them a lot of social, political, regulatory change as well. But I really think that at least from the design challenge to redesign how we think of innovation policy, industrial strategy, procurement policy, there's lots of really important lessons. And, starting with the challenge, turning it into a mission, getting lots of different sectors involved, and really galvanizing, catalyzing, and crowding in bottom-up experimentation to get there is what this is all about. And in the book, I kind of reflect on that also in terms of economic theory, but also citizen engagement. But really, this design is about, starting with goals like climate change, turning it into something as concrete as, this was an example with Europe, having 100 carbon neutral cities, getting as many different sectors like construction, real estate, and so on, and redesigning the procurement grants and loans in such a way that really do reward those that are willing, so picking the willing, not picking the winners, willing to come along the way to go after these problems. And that means no longer thinking about industrial strategy, for example, as just a list of sectors, life sciences, automobiles, creative industries, but as huge problems that we have where we need to get all our different sectors involved. And this is some work I did with Greg Clark when he was Minister of Industry and Innovation here in the UK. I helped the UK government think of these four big challenges like clean growth, healthy aging, future of mobility, and turning, for example, you'll see the one of future mobility around a very concrete mission, which would include things like having travel that's 100% accessible, which means that some of those bottom-up projects are coming from areas, for example, of disabilities. And let me just focus my last 3 minutes here on health, because this is what you are talking about today. What's so important in the health area, where there's so much public money actually going in, right? So in the US, for example, 40 billion a year is spent by the government on health innovation, and somehow then we don't get the intellectual property rights to reflect that, right? Because intellectual property rights, patents really need to be, well, they are a contract between the state and business, and if we are abusing them along the way, if they are too wide, used for strategic reasons, too strong, so hard to license, too upstream, so we're patenting the actual tools for research, then that actually isn't a good deal. Coming back to the fairness that NASA cared about, a good deal for the public side. Also, the prices of the drugs are often not reflecting that public contribution. Just think of the recent COVID therapy remdesivir. It's being charged by Gilead, a pharmaceutical company, for over $3,000 per dosage, and yet it got $70.5 million in support from the National Institutes of Health. But this is actually quite common across the board. So I've been thinking a lot recently. This was a report I wrote with some colleagues 3 years ago called The People's Prescription, which, interestingly sounds like the people's vaccine, which is being put forward by the World Health Organization. And what they are talking today in terms of the people's vaccine is it's not enough to have a vaccine. We need to, again, make sure it's accessible. So we should be thinking about things like a patent pool. We need to be making sure that the collaborations aren't causing, vaccine apartheid and so on. So how we govern innovation really matters. And what's interesting is that, that organizational dimension that I talked about in the beginning, where NASA looked within to be more purpose-driven, we need to ask ourselves, what would a purpose-driven health kind of organization look like? And in that report, we put forward that we should have a health-related ARPA, which I don't have time to go into now, but really the idea that it would be purpose-driven. So you're not just flooding the system with a lot of public money around drugs, but also really aligning it so that how we're governing the innovation process and the access at the end, is reflecting that collective creation of value. And again, people like AOC in the US have been arguing this for quite a while. Actually, I'd spoken to her even before she became a congresswoman about what it would look like actually to have, a purpose-driven innovation system. And it really would look a lot different from what we have today. And I think, just to end, this COVID moment is really important because what we're seeing is huge amounts of money being poured into the system, $2 trillion in the US with the recovery scheme. What does it mean to embed within these recovery schemes now in order to build back better? A very different public-private relationship. This is the Minister of Finance in France who's put conditionalities around lowering carbon emissions for companies getting bailouts. Or in Austria and Denmark, they've said, if you are used to, avoiding your tax, you won't be able to get that. So what does it mean really to walk the talk of stakeholder value, no longer make it just a corporate governance issue, but very much put it at the center of that public-private interface. And I really welcome your whole audience to think about this in the health area. And let's start with examples, learn from it, and then scale it up and do a very different type of public-private relationship, because we cannot afford to not to.